Interpretation of an electrocardiogram, known as an ECG or EKG, is a skill in medicine that is often overlooked. In this video, I'll provide a systematic approach to help you read them more confidently. The basics to remember are that each component of the ECG represents electrical activity within the heart corresponding to different points in the cardiac cycle. For example, the P wave represents atrial depolarization, and we will look at each of these points in more detail as part of the interpretation. A normal 12-lead ECG is taken by using 4 limb electrodes and 6 chest electrodes. Each lead gives a slightly different view of the heart, with a positive deflection when the activity is towards that electrode and negative when it is away from it. Leads 1, AVL, V5 and V6 look at the lateral part of the heart, 2, 3 and AVF, the inferior part, and V1 to V4 give a septal and anterior view. The first step is to ensure the correct patient information, the date, and the calibration of the machine. The date and time are especially important because you may be looking at one of a series of ECGs, looking for changes over time. The calibration is normally 25 mm per second and 10 mm per millivolt. If these settings are adjusted before the ECG is taken, it can look completely different, so you need to check it before you start interpreting. Once they are confirmed, I start by looking at the axis because it is so easy to overlook. The overall direction of the electrical activity gives the axis, and is normally between -30 and 90 degrees. It could be normal, deviated to the left or to the right, or extremely deviated. A quick way to assess it is the quadrant method that allows you to quickly place the axis in one of the 4 quadrants just by looking at lead 1 and AVF. If both are positive, the axis must be in the lower right quadrant, therefore normal. If lead 1 is negative and AVF is positive, there is right axis deviation. If both are negative, there is extreme axis deviation. The only one needing a further step is if lead 1 is positive and AVF is negative, then the axis is in the upper right quadrant, and to distinguish left axis deviation from normal, you can look at lead 2. If it is negative, the axis is deviated to the left. Axis deviation can occur in many different conditions and is not specific, but looking at it first can alert you early